Hello, my name is Emily Farley. I am a pediatric PT as well as the primary recruiter here at Sanctum. So whenever you are looking for jobs, once you do graduate, once you're on Indeed, everything looking for jobs, you'll be talking to somebody like me. So today I'm gonna give you just a few tips on what to look for in a job posting, what to look for whenever you're talking to a recruiter like me, and hopefully that'll help you find the right fit. So let's first talk about if you're a newer graduate. So I've been in your shoes. I actually went straight out of my grad school program and went into home health. And one of the most important things to me was having mentorship. And that is sometimes a lot easier said than done. So just some red flags to look out for. When you're talking with a recruiter and they talk about all of these mentorship opportunities, ask just some deeper questions. Figure out what kind of mentorship opportunities. Try to talk to one of the mentors that they have in a mentor position right now, because a lot of these companies end up making empty promises and they can't uphold their end of the mentorship, which then in turn makes you feel burnt out and makes you feel like you're alone and just on an island by yourself. Another thing that just as a newer graduate that I looked for is trying to find someone who supports your clinical development and gives you some CEU support. So giving you learning opportunities throughout the year, having quarterly meetings where you can meet up with other supervisors in your position and being able to bounce ideas off of them and help you turn into the therapist that you truly want to become. Another thing that was really important to me as a PT was finding a position that I had room to grow. Because something that is not talked about enough is, okay, you graduate, you become a PT, you become an OT or an SLP, and where do you go after that? Where can I go after that? And all of these other, careers, they have a career path where they have a place to grow. And with a lot of companies, they don't offer that. So asking the recruiter, asking whoever does your interview what opportunities they have in regards to career development, whether that includes you stepping into a mentorship position, whether that means you becoming a supervisor in some capacity, or you taking over another role within the company, such as a recruiter, doing something to be able to diversify your resume and be able to continue building on top of what you already have is very helpful and very important to look for whenever you're trying to find a company to work for. For example, here at Sanctum, we try to have a career path for every single discipline, whether it being SLP, PT, or OT. You start off just as a treating therapist and then being able to grow into a supervisory role. With each of the disciplines, it looks a little bit different. So like we can go into speech therapy. So for our speech therapy department, you start off as an SLP and then you can work your way up to becoming a supervising SLP for SLPAs. And we also have our clinical fellowship program, our CF program, which is geared towards newer graduates, and that is an entirely different entity than just supervising SLPAs. So you have room to grow in that to where you're not just becoming a treating SLPA, you have other roles within the company that can end up being more of a leadership role. In addition to that, Sanctum also, we have this thing called the SLA, the Sanctum Leadership Academy. And we would never want to put you in a leadership role if you have no prior knowledge or no prior experience being in a leadership role. We want you to wear the Sanctum name right and be able to be the best possible leader and mentor to those newer graduates, to those SLPAs or assistants as you can. So we put you through, I believe it's a 6-week long program, and it basically teaches you how to be a leader the way that Sanctum wants you to lead. So you don't have to try to find a spot that has all of these, that offers all of these awesome opportunities. However, just finding some place that offers a few that are important to you is the goal. Whenever I was looking for a job, another thing that was really important to me was finding a company that had a culture or a vision that aligned with mine. So to me, interdisciplinary collaboration is really important. Being able to talk to, other therapists, such as OTs or SLPs, or even, also some PTs, just to be able to bounce ideas off of, because that is the way that you are going to get the best treatment for the child. So being able to find a company that stands on that and, also has those visions. Do they prioritize patient care, or do they prioritize the productivity and numbers? At the end of the day, at least at Sanctum, we prioritize patient care, and we have learned that if we pour into our therapists and their clinical development, then they are better able to pour into their patients and the patient care. One of the big things in healthcare is burnout. Everybody's feeling burnt out all the time, so finding a company that really values work-life balance, and that goes hand in hand with the productivity standards. Do they value patient care, you and your work-life balance, or do they value getting the most bang for their buck and working you into the ground? So once again, trying to find a company that truly does value you, your time, your clinical expertise, and they want to pour into you in the way that you are passionate about pouring into your patients. So another thing to think about is what setting you want to work in, whether it be home health, whether it be a clinic, whether it be skilled nursing facility, assisted living facility, and how the pay structure with that setting, how that aligns with you in your life. Everybody's going to want a different pay structure. Some people with home health, it's typically it's a pay per visit or pay per unit model. However, with a clinic, sometimes it's more of a salary base with bonuses. There is no right or wrong. It's just you having to decide what works better for you in your life. So what are some red flags to look out for whenever you're talking to a recruiter, whenever you are doing an interview, even whenever you're just looking at a job posting? Number one is mentorship. Them telling you they have mentorship, but then whenever you ask more probing questions, they don't have anything to back it up. They don't have names of mentors that you can reach out to talk to about, their mentorship styles and all those things, or they don't have specific examples as to how they provide mentorship, such as quarterly meetings, such as weekly meetings with your mentor to go over caseload collaborations. Another red flag is room for growth in the company. If they tell you they have all of these opportunities for you to be able to grow in different ways, but once again, they don't have anything to back that up. They can't give you specific examples of other people in the company who have started where you're going to be starting and what they're doing now. They don't have a clear outline as to how your career can look in the company. Another red flag is not being transparent with pay. There is a difference between giving you a range of pay based on your experience, but then there's also them just not being transparent at all, not giving you the pay range, not telling you, yes, it's pay per visit, or it's pay per unit, or it's a salary, or it's a hybrid model. Anywhere where they're not being transparent with you, I would count as a red flag. So another big thing for me, after now being a treating therapist for over 3 years, is whenever I'm looking for a job, I look at what documentation system they use, because that can really make or break you. So if it's a documentation system that you've used before during one of your clinical experiences during grad school and you knew it was rigorous, it took a lot of time, it was a lot of typing, it was not your favorite, then maybe you don't choose a job that offers that EMR system. I know it seems like it's such a minute detail, but that's something you're gonna be using every single day. And if it's not user-friendly, if you didn't like it, then that's gonna really change the way that you view the job on a daily basis. So for example, with Sanctum, we use CubHub. I personally really like CubHub because I feel like it's very user-friendly. We are primarily a home health company, so it's nice because just daily visits are done on your phone. It is an app on your phone. Everybody always has their phone on them. You typically don't have to, connect to a hotspot or anything, so you can really get, I feel like, your daily notes out very quickly. Not all systems are like that. And that's just something that I feel like it comes with experience, but also a lot of people have a lot of different experiences with EMR systems throughout grad school. Take what you learned in grad school and try to apply it as best as you can when looking for a job. Oh my God, don't even get me started on can time. It's the worst. So, how to do research on a company and what to look for whenever you're looking into a company. So a lot of the times, obviously, you can go on their website. We have a killer website, it looks great. But also you can go on Indeed. And Indeed, a lot of the times, Indeed, Glassdoor, even ZipRecruiter, you can actually look at reviews from current employees or from past employees. I can honestly say you can sometimes tell whether it is a true, honest review or whether it's a review that they just put in just to get some sort of incentive from the boss. So it's very obvious sometimes between honest reviews and dishonest reviews. But I would just look there and just kind of get the general consensus. And they even break it down between, pay, like what you were being paid. That way you can kind of align what you're seeing on Indeed from actual employees versus what they're posting on their job postings and kind of see if that aligns. So you can look at pay. You can also look at like what their benefits are like. A lot of employees do go into what kind of benefits they got. Even sometimes there's some reviews that go into mentorship and go into learning opportunities and CEU opportunities. That's a very nice and easy way to try to get some reviews off of a company from current employees. So one of the great things that Sanctum offers, we are primarily a pediatric home health company. We do have a clinic in Fort Worth, but one of the really great things that we offer that is something that most home health companies don't offer is a residency program, specifically for the OTs. We're still working on it for PT. So it's a year-long program after you graduate. So as a new graduate, I know that home health, it just has a stigma about it that you're not gonna get the proper mentorship, you're not gonna get the proper supervision, you're not gonna be able to grow as a clinician. And Sanctum is trying to change the way that people view that, especially newer graduates, because I can honestly say that home health typically does attract new graduates. So that is why we have started, or Joni has started, the residency program. It's a year-long program, and typically you meet once a week with Joni and the other OTs that are in the residency program. And it's just a great way to learn, whether it be she is taking you along to another session with her, whether it be, you're in the clinic or the office just learning from her. It's a great way that you can be mentored. You can pick her brain, somebody who has years of experience. So it really is a great program to help you flourish into the OT that you want to become. So, I'm sure you're wondering how to make yourself stand out to somebody like me, a recruiter. There are a few things. One, it's gonna come down to your resume. Obviously, I love a pretty resume, but that's just me. But being clear and concise on your resume, not too many words, and also always include your clinical experience. I know as a new grad, obviously that's really the only experience you have, but even as a practicing PT, OT, SLP, it's really nice being able to see what kind of clinical experience you had while you were in school and see if it's applicable to what we do here at Sanctum. In regards to the initial phone call with a recruiter, so typically once you apply for the position, then a recruiter like myself will reach out to you before doing a formal interview. Just to get to know each other, figure out what exactly you're looking for, and make sure you're not a bot and I'm not a bot. On the phone call with me or with a recruiter, I think the most important thing is for you to be transparent. You want them to be transparent with you, so you need to be just as transparent with them. And really try just to be yourself. There's no reason to be nervous. I'm not judging you to an extent. I'm on your side. I'm here to help you, and it's just a phone call, just getting to know each other, just to see if I think it'll be a good fit and if you think it'll be a good fit based on where you see your career goals and what we can offer you. And it's just an easy way for you to learn about the company. So the way that I think about it is the recruiting call is for me to tell you about the company. I'm getting a general overview of you, and I'm telling you a lot about the company. In the interview is where we're really going to dive into your clinical skills. That's where you really get to showcase yourself. But my job with the initial call is to tell you about Sanctum and everything we can offer you for you to feel like it's a good fit. Another thing to think about whenever you are applying for positions is what is most important to you. Is it the money? Is it the paycheck? Is it the mentorship? Is it the clinical development? Is it having reimbursement for your CEUs? I'm not gonna sit here and say there is a right or wrong answer to any of that. You need to understand that sometimes if you wanna be a cash cow, you may be treated like a cash cow, and that may come with, unrealistic standards whenever it comes to productivity. It may come with you're not getting as much mentorship as you originally thought that you wanted. So there are pros and cons, and some companies may offer you tons of mentorship and a very great pay rate. Other companies, they pour in a lot of resources to you, into your clinical development and your career development, and then you may not see it on the paycheck quite as much because you're getting so much poured into you. So once again, really just trying to decide what is most important to you, and nobody can tell you that except for yourself. All right, so hopefully you enjoyed this and you learned something from it. And if you did, go ahead and subscribe. And if you want to learn more about Sanctum, you can go to our website, linked below. I didn't know if it was linked below or not.